Top 25 Hospice Care Assistant interview questions and answers. Working as a hospice care assistant requires compassion, emotional resilience, and the ability to provide comfort to patients and their families during challenging times. Interviewers look for candidates who understand the importance of dignity, empathetic care, and effective communication. This guide provides a top 25 hospice care assistant interview questions with well-crafted 90-word answers to help you confidently express your skills, experience, and passion. Reviewing these responses will prepare you to succeed and stand out as a strong candidate. 1. Why do you want to work as a hospice care assistant? I want to work as a hospice care assistant because providing comfort, compassion, and dignity to patients during their final stages of life is deeply meaningful to me. I am motivated by the opportunity to make a difference through emotional support, attentive care, and dependable service. Hospice work allows me to build strong connections with families and help ease their stress during difficult times. My passion for patient-centered care and my commitment to empathy make this role a perfect fit. 2. What does hospice care mean to you? To me, hospice care means providing holistic support that focuses on comfort, dignity, and emotional peace rather than curative treatment. It involves helping patients manage pain, supporting their personal wishes, and ensuring they feel respected and valued. Hospice care also extends to families, offering guidance, reassurance, and compassionate communication. It is about being present, attentive, and empathetic during one of the most delicate phases of life, ensuring the patient's final days are as meaningful and comfortable as possible. 3. How do you handle emotional stress when working with end-of-life patients? I handle emotional stress by maintaining healthy boundaries while still showing empathy and compassion. I practice mindfulness and self-care activities outside work to recharge emotionally. During challenging moments, I remind myself of the positive impact I'm making on patients and families. I also seek support from my team, as open communication helps relieve stress. By balancing professionalism with empathy, I stay emotionally resilient and able to provide high-quality care without becoming overwhelmed or losing focus on my responsibilities. 4. How you communicate with patients who are nonverbal or unresponsive. When caring for nonverbal or unresponsive patients, I focus on observing their body language, facial expressions, breathing patterns, and any signs of discomfort. I speak to them with respect, explain what I'm doing, and maintain a calm, soothing tone. Even if they cannot respond, I believe presence and empathy are essential. I also coordinate closely with nurses to monitor changes and ensure appropriate interventions. My goal is always to provide comfort, reassurance, and dignity during every interaction. 5. How would you support a grieving family member? I support grieving family members by listening attentively, offering reassurance, and creating a calm environment where they feel safe expressing their emotions. I approach them with empathy and avoid making assumptions about their feelings. I provide clear updates on the patient's condition and assist with practical needs to reduce stress. When appropriate, I guide them toward counseling or bereavement services. My goal is to remain compassionate, patient, and respectful while ensuring they never feel alone during this difficult time. 6. What would you do if a patient refuses personal care? If a patient refuses personal care, I first try to understand the reason behind their refusal by speaking gently and respectfully. I reassure them and explain the importance of the task while giving them time to feel comfortable. I never force care. Instead, I offer choices to maintain their sense of control. If the refusal continues, I report to the nurse and document the behavior. My priority is always to maintain dignity, safety, and trust. 7. How do you ensure patient dignity during personal care tasks? I ensure patient dignity by always explaining the steps before beginning care, seeking consent, and maintaining privacy through appropriate draping and room setup. I work gently and respectfully, avoiding rushed or mechanical movements. I encourage independence where possible and ask for preferences regarding hygiene routines. I communicate clearly and use a warm, respectful tone. My focus is on making the patient feel valued and respected, reinforcing that they remain in control even during sensitive or intimate tasks. 8. Describe how you work as part of a multidisciplinary hospice team. I work effectively within a multidisciplinary hospice team by maintaining clear communication, respecting each member's role, and sharing observations promptly to support patient care. I document accurately and pass on relevant updates to nurses, social workers, and therapists. I collaborate during care planning, contribute suggestions when appropriate, and support team decisions. I also step in to assist colleagues when needed. My teamwork approach is rooted in compassion, respect, and a shared commitment to providing the best end-of-life care. 9. How you handle conflicts with coworkers. When conflict arises, I approach them calmly and professionally. I focus on understanding the other person's perspective and working toward a respectful solution. I avoid blame, instead using clear and polite communication to discuss the issue. If needed, I involve a supervisor for guidance. My goal is to maintain a positive working environment because teamwork is essential in hospice care. Resolving conflicts quickly ensures patients receive consistent, compassionate support from a unified and cooperative team. 10. What would you do if you notice a sudden change in a patient's condition? If I observed a sudden change in a patient condition, I would immediately document the symptoms and notify the nurse or supervisor without delay. Quick communication is critical in hospice settings to ensure the patient receives appropriate care. I remain calm, supportive, and attentive to the patient during the process. I also inform the family if it is part of my responsibility. Ensuring safety, comfort, and accuracy is my top priority whenever condition changes occur. 11. How do you prioritize tasks during a busy shift? I prioritize tasks by identifying the most urgent needs first, such as patients in pain or requiring immediate assistance. I rely on the care plan and communicate with the nursing team to coordinate responsibilities. I also stay organized by keeping my schedule flexible and adapting to unexpected changes. Throughout the shift, I remain calm, focused, and prepared. My goal is to provide safe, attentive care while ensuring no patient feels neglected or rushed. 12. Describe a time you comforted someone in distress. I once supported a patient's daughter who was overwhelmed with grief. I offered a quiet space, listened to her concerns, and reassured her that her feelings were valid. I explained the patient's condition calmly and encouraged her to spend meaningful time with her parent. She later thanked me for being a comforting presence. This experience reinforced for me how compassion, patience, and attentive listening can significantly support families during emotionally difficult moments. 13. How do you maintain professional boundaries with patients and families? I maintain professional boundaries by remaining compassionate yet aware of my role. I avoid sharing personal details or becoming overly involved emotionally. I focus on providing support through attentive care, clear communication, and respectful behavior. If a situation feels emotionally overwhelming, I seek guidance from my supervisor. Professional boundaries protect both the patient and caregiver, allowing me to remain reliable, objective, and focus on delivering safe, respectful, and effective hospice care at all times. 14. How would you assist a patient with mobility challenges? I assist mobility challenge patients by following proper techniques, using mobility aids, and ensuring their safety throughout the process. I explain each step beforehand and encourage them to participate as much as they can. I monitor for signs of pain, dizziness, or weakness and adjust my support accordingly. If needed, I ask a colleague for help to avoid injury. My priority is to promote patient comfort, independence, and confidence while preventing falls or unnecessary strain. 15. How do you handle situations where patients express fear about dying? When a patient expresses fear about dying, I respond with empathy and patience. I listen carefully, acknowledging their emotions without minimizing them. I encourage open conversation and reassure them that they are not alone. I offer comfort through calming presence, gentle communication, and supportive touch when appropriate. I also notify the nurse or counselor so they can provide spiritual or emotional support. My goal is to create a safe space where the patient feels heard and understood. 16. What experience do you have with pain management support? I support pain management by monitoring patients closely, reporting symptoms, and assisting with comfort measures like repositioning, warm compresses, and relaxation techniques. I follow the care plan carefully and communicate regularly with nurses to ensure timely interventions. I also reassure patients, explaining what I'm doing to help ease discomfort. Although I don't administer medication, I play an important role in observing changes and helping maintain the patient's comfort and dignity throughout the pain management process. 17. How do you manage your time when caring for multiple patients? I manage time by assessing each patient's needs and planning my tasks according to urgency and care priorities. I stay organized through written notes and maintain flexibility for unexpected changes. Regular communication with the team ensures efficient coordination and prevents overlap. I avoid rushing tasks by remaining calm and focused. My approach allows me to deliver compassionate, thorough care to every patient while keeping the shift structured and manageable. 18. What would you do if a family member questioned the care you provided? If a family member questioned the care I provided, I would listen respectfully and calmly, acknowledging their concern. I would explain my actions clearly and factually, emphasizing the patient's comfort and safety. If the issue required further clarification, I would involve the nurse or supervisor. My goal is not to argue, but to reassure families that their loved one is receiving attentive, compassionate care. Maintaining trust and transparency is essential in hospice settings. 19. How do you provide spiritual support to patients who request it? I provide spiritual support by respecting the patient's beliefs and listening to their needs without judgment. If they request prayer, religious rituals, or contact with a spiritual leader, I help facilitate those requests. I offer comfort through presence, compassion, and reassurance. I also communicate their spiritual needs to the care team to ensure ongoing support. I believe respecting cultural and spiritual values is vital to delivering holistic, meaningful hospice care. 20. What skills make you a strong hospice care assistant? My strongest skills include compassion, patience communication, and emotional resilience. I excel at providing comfort, supporting families, and maintaining calm during stressful moments. I am detail-oriented, reliable, and committed to respecting patient dignity during all care tasks. I understand the importance of teamwork and follow care plans carefully. My ability to stay supportive, gentle, and emotionally present makes me well-suited for hospice work, where empathy and professionalism are essential. 21. How do you document patient care accurately? I document patient care accurately by recording observations, activities, and changes immediately or as soon as possible. I use clear, objective language and follow facility guidelines regarding formats and timelines. I avoid assumptions and only note details I directly observe. Accurate documentation ensures continuity of care and supports effective communication across the hospice team. It also helps identify changes in patient condition, ensuring timely interventions and consistent support for both patients and families. 22. How do you respond when a patient becomes agitated or anxious? If a patient becomes agitated or anxious, I first try to understand the cause by speaking calmly and observing their behavior. I offer reassurance, adjust the environment for comfort, and use gentle, grounding communication. I avoid confrontation and give them space if needed. If agitation persists, I notify the nurse to reassess the care plan. My focus is on ensuring safety, reducing distress, and helping the patient feel supported without escalating the situation. 23. Describe how you support patient independence. I support independence by encouraging patients to perform tasks they are capable of, even if it requires extra time. I provide guidance without taking over and offer adaptive tools when necessary. I respect their choices and involve them in decision-making about their care. Supporting independence helps maintain dignity, confidence, and emotional well-being. My goal is to ensure patients feel valued and capable, promoting comfort and quality of life throughout their hospice journey. 24. What steps do you take to prevent infection in hospice care? I prevent infection by following strict hygiene protocols, including regular hand washing, wearing protective equipment, and maintaining clean environments. I monitor patients for signs of infection and report changes immediately. I handle linens, waste, and personal care items according to safety guidelines. I also educate families about proper hygiene practices when necessary. Infection control protects vulnerable patients and ensures a safe environment where comfort and dignity remain the highest priorities. 25. Why should we hire you for this role? You should hire me because I bring compassion, reliability, and emotional strength to hospice care. I understand the unique needs of end-of-life patients and am committed to offering comfort, dignity, and respect. I work well in teams, communicate effectively, and remain calm during emotional situations. My dedication to holistic care ensures both patients and families feel supported. I am motivated, empathetic, and ready to contribute meaningfully to your hospice team. Thank you for reviewing these top 25 Hospice Care Assistant interview questions and answers. By practicing these responses, you will feel more confident, prepared, and equipped to present your compassion and skills effectively. Hospice care requires emotional strength, teamwork, and dedication, and these answers are designed to highlight your readiness for the role. Use them to strengthen your communication, build confidence, and make a lasting impression in your upcoming interview.